Cardiac arrest is the abrupt loss of heart function that may occur suddenly and unexpectedly, at any time and anywhere. When the heart stops beating, blood stops flowing to the rest of the body. Without treatment, brain damage and death will occur within minutes. Cardiac arrest has a large public health impact and is the leading cause of death across the globe. More than 350,000 people have an out-of-hospital cardiac arrest in the United States each year, almost enough to fill PNC Park 10 times over, and about 7 in 10 die before reaching the hospital. This occurs in part because only around 40% of victims receive cardiopulmonary resuscitation, or CPR, before professional help arrives. Every minute that goes by without CPR increases the likelihood that they will not survive. But early CPR can nearly triple the victim's chance of survival. As with many medical concerns, out-of-hospital cardiac arrest disproportionately affects underserved communities and people of color, as they're also less likely to receive CPR in those crucial early minutes when suffering a cardiac arrest. When cardiac arrest occurs, it is crucial to call 911 and activate the emergency response system, but it may take several minutes for EMS to arrive. Each of us have the ability to help save a life in that critical period by simply learning to do CPR and having the confidence to do it when the time comes. And since 74% of out-of-hospital cardiac arrest occur at home, life-saving skills like CPR are incredibly important. It may be your loved one with cardiac arrest someday.
What else do you think she's fixing?
I'm so hungry.
I think they're gonna win tonight. I'm telling you.
They don't have a chance. This one's gonna lose. You know that. They have a chance.
Oh, she's winning now.
Worked up in
Here we go.
Be careful.
It's hot. Watch out.
That's good.
Damn.
Grandma, you know that's my favorite.
Yes, I do. Made it just for you.
Ooh, child.
Yes.
You know, and as I was saying, your father would get away with just about everything, leaving Eddie to take all the blame. So I know you. That apple of his eye don't fall very far from the tree.
You feeling okay, Mama?
I'm fine. It was just hot in that kitchen. Ooh.
You sure now?
I'm fine. I'm gonna go sit down on the couch for just a couple moments. You all just enjoy your dinner.
Yeah, get you, some ice water.
Okay, I'm fine.
The ice water be good for you.
Sounds good.
Mom!
Oh,
No.
oh,
Please.
Rose!
Someone help!
Rose, somebody call
Mom.
somebody!
No, Mom! Please, someone help! Oh my goodness, Mom! Please! Wake up!
Somebody do something!
Mom! Wake up, Mom!
Rose!
County 911, what's the address of your emergency?
215 Rocks Hill Road. My grandma, I think she's not breathing.
Okay, I'm getting help. Just confirm with me, what city, township, or borough are you located in?
Mount Cloverton.
Clifton. Okay. Now tell me exactly what happened.
We were having dinner and she said that she just wasn't feeling well.
I have help on the way. An ambulance is being dispatched. A volunteer responder may arrive to help before they do.
Please hurry.
Where is she now?
She's on the couch.
Okay. Can you carefully pull her off the couch and onto the ground? She needs to be on a hard surface.
Grandma, she's definitely not breathing. She's on the floor now.
Place the phone on speakerphone if you can and keep the phone close. I want you to kneel by her side and make sure she's on her back, facing up. Okay, can you pull her shirt up so you can see her chest? I want you to put your hands right in the middle. Use the palm of your hand. We're going to put one in the center of her chest and the other on top. And as hard as you can, keeping your arms straight, I want you to push down like you're pumping on her chest. Do it quickly and count out loud with me.
Okay. 1, 2, 3, 4,
You need to go faster.
5,
Count with me. 1 and 2 and 3. Keep going.
4, 5, 6, 7, 8, 9, 10.
I know this is hard. Help is on the way. You're doing a great job. Have someone unlock the door. Paramedics are en route. Do you know if your grandma has any medical problems?
Not that I know of.
And do you know her age?
It's 50, 52. Wake up, Grandma! I don't know if this is working.
You're doing great. I know this is very hard, but help is on the way. Doing a great job. Push as hard as you can. Fast and forceful compressions. A community volunteer may arrive shortly wearing a red vest.
I'm running out of breath.
Doing great. Keep going, and I know this is tiring. Someone will take over for you soon. It should not be too much longer.
When do I stop?
Unless she wakes up, keep going. Help is almost there.
Okay.
Keep your arms straight and keep pushing hard and fast.
Am I hurting her?
She's not in pain. You're doing great. I can hear you. Shouldn't be too much longer. Just keep going with that.
Adult CPR. If you suspect an emergency, your first step is to look around and make sure your scene is safe. Your safety needs to be your top priority. Once you're sure it is safe to approach the patient, give them a tap and shout to see if they are responsive.
Are you okay?
If they are not responsive, call 911 or designate someone nearby. Next, check to see if the patient is breathing using the technique look, listen, feel. We are looking for chest rise, listening for breath, and feeling for breath on our cheek for 6 to 10 seconds. If they are not breathing, start CPR. To start CPR, we want to make sure that our patient is on a firm, flat surface. If possible, expose the patient's chest to prepare for AED placement later on. Place the heel of your palm on the center of the chest, about nipple line, and stack your other hand on top. Lock your elbows and bring your shoulders directly over the center of the chest. We want our body weight to help us when giving compressions. Push down 2 inches in depth and let the chest recoil at a rate of 100 to 120 beats per minute, or to the rate of songs such as Staying Alive or Baby Shark. If you hear the cracking of cartilage or ribs, do not stop. Continue CPR until someone is there to take over. The scene becomes unsafe or the patient regains consciousness.
When you come across someone who is unconscious, make sure the scene is safe. After that, check the level of responsiveness, then call 911, assess their breathing, and make sure you start CPR early. This is where community responders play a role. At times, you may not be able to respond to an alert, and this is completely fine. Anyone can utilize pulse point when responding to a patient that is in cardiac arrest, but only specially trained individuals are authorized to be community responders. These folks may be your friend, family, or neighbor. but they're all volunteers. As you approach the scene, be sure to be aware of your surroundings. This is especially important when crossing roads and parking lots. Remember, your scene safety check starts as soon as you receive your alert and continues until you return home. Once you arrive at the location, double check to make sure you have the right address. Before entering the scene, take a moment to take a deep breath and collect your thoughts.
Please come in.
I'm a community responder. I'm here to help.
When approaching the scene, scan the area for exits, hazards, or threats to your safety and your patient's safety. If the scene is not safe, call 911 to update them with what you observed while exiting the scene.
Doing everything I can until paramedics arrive.
Your safety is our priority. Do not become patient number 2. Early CPR improves the chance of survival and your patient's quality of life. Before arriving on the scene,
Excuse me.
make sure you look for the AED or direct someone to grab it for you. The pulse point map will show you all of the AEDs near the address of the alert. High quality CPR is a priority, but grab an AED if it's on the way and will not delay you significantly.
Come in.
It's important to communicate with whoever is helping on scene.
I've been doing CPR for 4 minutes.
Apply pads to patient's bare chest.
Once the AED finishes analyzing, I'll take over.
Individuals performing CPR may not hear the instructions from the
Do
AED
not touch the patient.
due to the highly
Analyzing
stressful
heart
nature
rhythm.
of medical
Do not touch
emergencies.
the patient. Analyzing heart
Make sure they follow the cues
Shock
of when not
advised.
to touch the
Charging.
patient.
Stay clear of patient.
Clear.
Deliver shock now. Press the orange button now.
Shocking.
When the AED is analyzing is the perfect time to rotate who is doing chest compressions.
CPR.
Adult AED. An automated external defibrillator, or AED, is a machine that can detect and restart someone's heart if they are experiencing certain types of rhythms that cause cardiac arrest. The first step when receiving an AED is to turn it on and start removing any clothing on the chest, if not already done.
Apply pads to patient's bare chest.
Next, find and apply AED adult pads to bare skin on the upper right and lower left of the chest, mirroring the pictures on the pads. Plug in the pad connector to the AED.
Do not touch the patient. Analyzing heart rhythm.
The AED will tell you not to touch the patient as it analyzes their heart rhythm.
Stay clear of patient.
The AED will advise whether or not they need a shock. If no shock is needed, resume CPR and leave the AED on and attached. If a shock is advised, check to make sure no one is touching the patient while the AED is charging.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Yell, "Clear!" and shock when ready.
Shock delivered. It is safe to touch the patient.
Resume CPR and leave the AED attached and on. The AED will reevaluate every 2 minutes to see if the patient needs a shock. This is a great time to switch who is performing compressions so you can provide high-quality chest compressions continuously.
It's important to do compressions until EMS states they are ready to take over.
She's right here. I'll keep doing compressions.
We're community responders. We responded to the call about 3 to 4 minutes ago. And We've been doing CPR for about 7 minutes,
Okay, I can take over compression for you. Thank you.
and she's received 1 shock.
All right, can I confirm that she has no
My name's
pulse?
Johnson with the paramedics. What happened today?
All right, there's no pulse. She's not breathing. Let's go ahead.
We were just eating dinner, and she started feeling hot, and we just started to lay down, and she just collapsed.
Okay. Did she complain of anything? Chest pain, trouble breathing? Did
No,
she felt okay?
She was just feeling hot.
Okay. They're just can put the heart monitor on her so we can check her heart. Okay. We're gonna get a tube down her throat to help her breathe. All right.
It's
And
my
then we're
mom,
gonna give her.
you know?
I understand. She's in really good hands. They're gonna take good care of her. All right. We're gonna give her some medicine and try and get her heart started. All right. You're welcome to stay here and watch. All right. Or we can take you in another room. And
No, I gotta stay here. I gotta stay here.
all right. She's in great hands. All right. We're gonna take very good care of her. All right.
Come on, Mom.
Pulse and rhythm check in 3, 2, 1.
All right, feeling for a pulse.
All right, it's a shockable rhythm. Resume
There's no
compressions.
pulse.
Charging. Clear.
Clear.
Shock delivered. Resume CPR.
And let's get a line. All right, let me know when we're ready for a pulse check.
We're ready. IO's in. Epi, thank you.
All right, go ahead and push the epi whenever you're ready.
We're good to go. Epi's in.
All right, let me know when you're ready for rhythm check.
Rhythm check in 3, 2, 1.
It may take EMS some time to arrive, which is why community responders are so important. They improve the chance of survival from cardiac arrest by providing early, high-quality, hands-only CPR.
Good job. You guys did great. Thank you. Okay, we're gonna take great care of her. We'll meet you guys up at the hospital, okay?
Thank you. Thank you.
Medical emergencies can be very stressful to all involved. The Center for Cardiac Arrest Survival has resources in place to support cardiac arrest survivors, loved ones, and community responders involved. Please do not hesitate to reach out. It is important to return an AED to its storage location and use the contact information on the unit to signal need for maintenance. Cardiac arrest can be stressful for the individual who performed bystander CPR as well. It is recommended to reach out to loved ones following a cardiac arrest and being honest about how you feel.
Hey, Mom, do you have time to talk? Yeah, no, I'm fine. I just got back from the call. Yeah, no, I think she's gonna be okay, but, it was just tough. I wanted to check in on her.
There is no wrong way to feel.
Rose, everything really sounds great. How you feeling?
Overall, I'm okay. Just my chest hurts. I feel like I may have broken a few bones.
Grandma, the community volunteers sent me to hurt you.
You know, they were so important to saving your life. And with them doing CPR, they may have caused some broken bones, but those are going to heal quickly. And I think we can give you some medicine to make you feel better.
Okay, thank you.
If you or a loved one have gone through a cardiac arrest and are now a cardiac arrest survivor, you should be aware of a few things. You've endured a very stressful event, and being a survivor or co-survivor has long-term effects. These can be your heart, your brain, or your organs. Everyone's recovery is different, and it may take you some time to get back to where you were before the cardiac arrest. However, most survivors who go home have a complete recovery and get back to all the things they love to do. Leaving the hospital and returning home after your cardiac arrest is a major step towards your recovery. However, the in-hospital portion of your care is only the first step in the recovery process, and your recovery can sometimes take several months or more. You may need some support to complete the physical things you need to do, such as chores or driving. You may need to be off work for some time after discharge. This can be challenging. However, usually these restrictions are temporary. You may notice difficulty with your thought process, what medical professionals call cognitive dysfunction. Sometimes when you go home, this seems worse due to the complex environment at home. You may be asked to avoid certain tasks until you can complete them. For example, you may be asked not to be alone at home or not make financial decisions until you're ready to do so. Generally, cardiac arrest survivors see continuous improvement in these difficulties. Again, a rehab plan can help accelerate this process. Finally, both survivors and co-survivors may have emotional or spiritual needs after they leave the hospital and go back to their daily activities. Going home or back to work may trigger some of these in you. Other post-cardiac arrest survivors have emotional feelings later, such as 3 to 6 months after leaving the hospital. These feelings are common and normal. Many survivors feel better after seeing a mental health professional, therapist, or spiritual advisor. You can find information on support here. These organizations can help you meet other survivors and co-survivors for peer support. You can also call the UPMC Post-Cardiac Arrest Service and speak with one of our cardiac arrest specialists. However, if you ever feel like you're having an emergency, please call 911 or go to the nearest emergency department.
At the Center for Cardiac Arrest Survival, we strive to educate and empower communities with the knowledge and skills needed for a rapid response to time-critical emergencies like out-of-hospital cardiac arrest. As few as 10% of people survive cardiac arrest. For those that do, it's because of the timely action of neighbors and loved ones. You can make a difference by learning CPR today and becoming a community lifesaver to help more people survive and go home to their families. Learn the skills to become a lifesaver. Thank you.
Pediatric CPR. The AHA defines children as those between ages 1 through 8. If you are unsure of the age of your patient, look for signs of puberty such as facial hair, an Adam's apple, or breast development to decide if they need pediatric or adult CPR. There are two big differences between pediatric and adult CPR. The first is that you may use one hand to give chest compressions about a third of the chest in depth. The second is that the breaths are recommended for children during CPR, which should be given at a rate of 2 breaths for every 30 chest compressions. When giving breaths, plug the nose and blow directly into the mouth while looking for a slight chest rise. Remember, a child's lungs are smaller than an adult's lungs. Pediatric AED. The first step when receiving an AED is to turn it on and start removing any clothing on the chest if not already done. Next, apply the AED pads to bare skin on the center of the chest and center of the shoulder blades, mirroring the pictures on the pads. Plug in the pad connector to the AED. The AED will tell you not to touch the patient as it analyzes their heart rhythm. The AED will advise whether or not they need a shock. If no shock is needed, resume CPR and leave the AED on and attached. If a shock is advised, check to make sure no one is touching the patient while the AED is charging. Yell, "Clear!" and press the shock button when ready. Resume CPR and leave the AED attached and on. The AED will reevaluate every 2 minutes to see if the patient needs a shock. This is a great time to switch who is performing compressions, so you can provide high-quality chest compressions continuously. Infant CPR. Those 1 year and younger. As always, make sure your scene is safe. Ask for consent to help. To check for responsiveness of the infant, tap their foot. If they do not respond, call or have someone call 911. Check for breathing using look, listen, feel. Looking for chest rise, listening for breath, and feeling for breath on your cheek for no more than 10 seconds. If the infant is not breathing, start CPR at a ratio of 30 compressions to 2 breaths. Give compressions using 2 fingers or 2 knuckles in the center of the chest. You may also hold the infant between your hands and use both thumbs for compressions. For breaths, cover the mouth and nose with your mouth while giving small breaths and looking for a slight chest rise. Infants also receive CPR at a rate of 100 to 120 beats per minute, pushing about 1/3 of the chest in depth. Infant AED. The first step when receiving an AED is to turn it on and start removing any clothing on the chest if not already done. Next, apply the AED pads to bare skin on the center of the chest and center of the shoulder blades, mirroring the pictures on the pads. Plug in the pad connector to the AED. The AED will tell you not to touch the patient as it analyzes their heart rhythm. The AED will advise whether or not they need a shock. If no shock is needed, resume CPR and leave the AED on and attached. If a shock is advised, check to make sure no one is touching the patient while the AED is charging. Yell, "Clear!" and press the shock button when ready. Resume CPR and leave the AED attached and on. Hemorrhage control. For major life-threatening bleeds, it is important to act fast. Focus on controlling the bleed and maintaining a safe scene. Do not stay in an unsafe scene. Life-threatening bleeds may appear as a fast-growing pool of blood or a spray and are not controlled by standard bandaging. Personal protective equipment such as gloves are recommended if you have access to them. Otherwise, discuss exposure with your primary health care provider or the emergency services on scene. First, apply pressure using your whole body weight. Start searching around you for items such as towels or shirts to ball up in place on the wound and continue applying pressure. If the bleeding does not stop, start packing the wound with items such as shirts, towels, or socks. Continue packing until nothing else can be shoved into the wound. Ball up the rest of the material on top of the wound and continue applying pressure. Infection can be dealt with in hospital. The priority is to control the hemorrhage. If the wound is on a limb, you may apply a tourniquet if you have one available and the bleeding has not been controlled with pressure and packing. Place a tourniquet 2 to 3 inches above the wound and tighten the strap. Secure the Velcro band and start to turn the rod, known as windlass. Turn the windlass until the bleeding stops or until you physically cannot turn it anymore. Lock the windlass in place underneath the clip and take note of the time. Once you have controlled the bleeding, call 911 and maintain whatever bleeding control methods you have started. Narcan. If an overdose is suspected, naloxone, also known as Narcan, is recommended as well as calling 911. An overdose may be suspected for those who have shallow breathing or no breathing, have drug paraphernalia nearby, have a known history of drug use, or have trouble waking up despite a firm tap and shout. To administer Narcan, insert the applicator nozzle into the patient's nostril and press the plunger. Afterwards, step back from the patient and wait 2 to 3 minutes while observing for changes. If the patient does not regain consciousness, repeat the process until they regain consciousness or until help arrives. If the patient is not breathing, perform CPR and recheck every 2 minutes.
Thank you for taking the time to become a community responder. We hope you never have to experience an emergency such as cardiac arrest. But if you do, you will feel confident in your abilities to recognize the issue, communicate with 911, and perform high-quality CPR while maintaining your own safety.